я Миса, и я очень хочу, чтобы у меня был свой YouTube, такой длинный YouTube канал. А мама сказала, что мне нельзя телевизор, потому что у меня проблемы с головой. Ну, не с головой, а мама сказала, что у меня сын делал. Вот так висит. И мама сказала, так их телевизор не пускают. Вот. И она сказала, мама сказала, надо пойти к доктору и сделать операцию тут на шее. И тогда вот так голова не будет падать у меня, а будет так вот, и не надо вот так руками и лапами держать, и будет сама так стоять. И ладно, мам, я буду красива после операции. Да, конечно, Мишенька, ты будешь очень красива после операции. И вот мы сейчас с мамой поедем в больницу. Мы сейчас только приехали вот в больницу, и нам сказал тетенька одна, она сказала, идите на диванчик, садитесь, и сейчас придет хирург с вами разговаривать. Мам, кто такой хирург? Ну, я тебе потом объясню, мой золотой. Мама, что-то боюсь. Не бойся, миленький, все будет хорошо.
Good afternoon. My name is Mr. Montgomery Snodgrass III, and I'm a consultant as a craniofacial surgeon. Today we have scheduled surgery on a small Russian bear who is suffering from a condition called sternomastoid atrophy, which is a weakening of the neck muscles. So the procedure today will be a sternomastoid reconstruction. This condition, as you know, is a weakening of the muscles, which is brought on by excessive curiosity in the bear and his constant need to look in all directions at once. Also, Russian bears, as we know, are inert chatterboxes, and unfortunately, due to the weakening of the muscles, the head drooping forward, this has taken away the bear's ability to chat. So today's surgery, if successful, will give him back his chatterbox abilities and allow him to continue his curious ways. Good afternoon, Misha. Nice to see you again.
Good afternoon.
Good afternoon, doctor.
Good afternoon. I'm sure you remember me, Mr. WS. Are you all ready for today?
He doesn't know what the procedure is. He can't remember because he has sawdust in his head.
Well, I'm going to explain what the procedure is today and exactly what we're going to do. Okay? Okay, so just run over a couple of things again. You are Misha Kildюшов.
Yes.
And you are 25?
Да, ему 25.
Yeah, 25.
К сожалению,
I believe...
unfortunately, he has learning disability, so mom has to be with him all the time.
Okay.
Что?
So, just to go over what we're doing today, we're doing a sternomastoid reconstruction. To put it simply, we're going to make your neck nice and stiff again so you can lift your head up and chatter away.
Чего?
Ну, Миш, в общем, он говорит, что у тебя есть тут мышца вот тут в шейке, называется стерноклейдомастоид, и что она немножко ослабла, и поэтому головка у тебя вот так падает. А если эту мышцу укрепить, то так головка будет хорошо сидеть.
Теперь понял.
Yeah, so you can look around again, keep curious and chatter away.
Вот так могу делать снова. Ура!
Exactly, but not too much today.
Нет, okay.
It's a small procedure, shouldn't take any more than about an hour. Obviously, lots of benefits, curiosity, chatting, being able to look around. There is a risk, of course, and that risk is that it may need to be repeated in a few years, depending, of course, on how curious you are in the meantime.
Ну, Мишенька, ничего он не сказал. Я потом тебе объясню. Он сказал, что все будет хорошо.
Now, I know you've spoken about this with your mum at length, and all we need you to do now is sign a consent form, agreeing to have the procedure done, and we'll get mum to do that for you. Okay? I've signed it already and dated for today, and if you would like to sign this consent form, and then the anaesthetist will be along shortly, and we can get you ready for surgery.
Мам, что сказал?
Он сказал, что сейчас мама подпишет форму, согласится на твою операцию, и потом придет анестезиолог и дальше будет с тобой заниматься.
Со мной сниматься?
Да, Мишенька, с тобой придет анестезиолог сначала, а хирург пойдет готовиться к операции.
Понял, понял.
Okay,
Хорошо.
so Mum can just sign here. That's lovely. And I will see you later.
Окей.
Bye-bye, Misha. See you later.
А Этим, он такой веселый доктор, мне так он нравится. Ой, фу, устал я уже ждать их. Когда этот наш статист полетет?
Yeah.
Ой,
Hello again, Misha.
hello.
Hello. I'm not sure we met this morning. Maybe not. I see lots of patients. I see lots of
Мам,
patients.
что говорит?
Anyway, good morning. My name is Dr. Sharpstab. I'm the anaesthetist.
Вот,
And-
вот, мам, чего, штаб, чего, кто вообще запутали совсем мою голову?
Миша, это дядя, анестезиолог. Зовут его доктор... Sorry, name?
Dr. Sharpstab.
Доктор Шап... Простите, как? What again the name?
Sharpstab.
Доктор Шапстаб. И
I
он...
know. It's a funny name. That's why I chose the profession. Anyway, I'm the anaesthetist, so I'll be putting you to sleep for your procedure today. Okay?
Мам, что сказал?
Он сказал, что он тебя уложит спать.
Люблю спать.
Yeah, exactly. Fast asleep. Now, I do need to ask you some questions first before we carry on, okay? So, tell me, your name is Misha Kildyshaw.
Миша, да, Миша, мамина, Миша.
25 or 5, and you've come today for a sternомастер reconstruction under the care of Mr. W.S. And you've seen him today, and you've got a signed consent form.
Да, доктор, мы сейчас только что с ним разговаривали. Да.
Excellent, excellent. Now, a bit of history. Are you otherwise well? Are you a well bear?
He is.
A healthy bear.
Yeah,
He's a healthy
He's a
bear.
healthy bear.
So apart from this little droopy head, you're a healthy bear. Lovely.
Yes, he is.
Lovely. Now, do you take any regular medicines for any reason?
No, he doesn't.
No medicines?
No, he doesn't. A part of herbal medicine. He's taking
Right.
herbal medicine.
Okay. And what would that be?
That would be honey.
Honey.
In
All right.
excessive amounts.
Excessive amounts of honey, but not today. Nothing to eat or drink today?
Мам, что сказал?
Он спрашивает, ел ли ты сегодня мед?
Да, ел я мед, ничего не давай мне с утра, уже с голода что-то умиляюсь.
Nothing to drink
Ну,
today.
Миш, ну немножечко осталось, потерпи. He's very upset because he didn't have any honey today.
Oh, I know. It must be very difficult for a bear to go without honey. Anyway, it won't be long because you'll be off to sleep soon. And as soon as this operation is finished, you can have as much honey as you like. But don't tell the surgeon I said that. Okay. I need to ask you a quick question. Can you open your mouth for me so I can look inside your mouth?
Миша, он говорит, открой ротик широко.
Yes. That's lovely. Any loose teeth? Any wobbly teeth?
Мам, что?
Он спрашивает, зубки никакие у тебя там в ротике не болтаются, не шатаются, не отваливаются?
Нет.
No wobbly teeth.
Нет.
Any allergies to anything you know of? Are you allergic to anything?
Мам, что сказал?
Он спрашивает, есть у тебя аллергия какая-нибудь?
Аллергия? Что такое аллергия? У меня, мам, есть аллергия? А почему у меня нет аллергии? У всех есть, у меня нету. Ничего не дают мне.
Нет, Миш, аллергия это не очень хорошая вещь. Аллергия, когда человек болеет.
Oh, come on.
Нет, he doesn't have any allergies.
No allergies. That's good to know. Now, I do need to listen to your chest, just to listen to your heart and listen to your breathing. Is that okay?
Мишенька, он собирается тебя послушать.
Я сейчас буду много болтать, послушать, пока
Да нет, Миш, не разговор твой слушать, а вот здесь послушать, грудку тебе.
Okay. Are we ready?
Yes, we are.
Okay. Just breathe in and out. And in and out. And last time in and out. And just nice and still. Well, that all sounds lovely and healthy to me. Okay, I've got no other questions. Do you have any questions you'd like to ask me before I go?
Мам, ну какие же у меня вопросы? У меня только один вопрос, когда мед буду давать.
He's asking when when honey will be given?
Honey will be given when you get back to the ward after recovery and you're feeling better.
Доктор,
You might have a sore throat, so honey will benefit you greatly.
Хорошо, а это мне нравится, это мне нравится, это холодный водой, как я рад.
Lovely. Well, in that case, I'll see you later on. Bye-bye. Bye-bye, Mum.
Bye-bye.
Hello again, Misha. How are you? Nice to see you here. So, you need to pop a small cannula just in the back of your hand here, just so we can give you some anaesthetic and some fluids, because you've had nothing to eat or drink for such a long time. We need to give you some nice fluids to press you up with. Okay?
Мама!
Миша, ты не волнуйся, я тут. Мне разрешили здесь постоять рядышком.
So all we're going to do is find a little tiny vein in the back of the hand here. Okay. So you think about something nice and we're just going to pop. There you go. Oh, well done.
Больно!
Well done, Misha.
Что делает
That was
у меня
very-
мамочка?
That was very
Мишенька, все хорошо. Сейчас все будет хорошо тебе. Потерпи
well
немножечко.
done, Misha. That wasn't too bad, was it? Now, I have a special dressing just for bears. As we see, it has little bears on it. So we're going to just stick that in here now. Put one there. One over here. And then look at this. 2 teddy bears. Like so. There you go. That comes off. And that comes off there. There we are. How's that? Not too bad? Well done. Okay, so what we're going to do now is going to give you some fluids. Yeah, which is very, very good for you. And because you've had nothing to eat or drink for such a long time. And then we're going to pop off to sleep for a few minutes, okay? And that way, Mr. WS can do his job. Okay. So pop that under there. And we're just going to pop off to sleep now. So in we go. Right here. If you want to count backwards from 10, about now.
I only can count till 5, 5, 4, 3, 1, 2, 5, и потом всего 2, и...
There we go. Okay. Fast as it now. I'm going to give you a little option to breathe. Keep it up that way like so. And we'll just protect your eyes from the bright lights, etc. There we are. Okay, Ms. WS, all yours. Okay, so I'm Montgomery Snodgrass, consultant craniofacial surgeon, and our patient is now ready for surgery now. This is Mishka Kildjushov, who is a 25-year-old bear from Astrakhan. Okay, and I will be assisted by my lead nurse here, Miss Faintheart. Obviously, a procedure like this does take a lot of experience, and Miss Faintheart here is one of our most experienced scrub nurses and will be assisting me today. Okay, so Nurse Faintheart here is just going to prep the patient for us today. So if you just clean the area, the surgical area, and then we shall drape that as soon as that's done. Splendid. Now we're using what's called an aperture drape here to keep the sterile field clean. Just take that bit off there. And we shall clear the area like so. That's good. Lovely. Excellent. Okay, now scissors, please. And a swab. Thank you so much indeed. Okay, so we've done that. Make a small nick just in this stitching here. Just to open the area. Scissors to you. Small clip, please. Small curved. Thank you. And we'll just open that a bit further. going to do large curved now. Okay. You can just expose this area, and as you can see quite clearly, muscular atrophy, lots of space, lots of worn out muscle there. Completely reconstruction needed, obviously the right call. Thank you much. Okay, stuffing. I'll take some stuffing. Yeah, so small sections like this we placed in certain strategic positions. This doesn't hurt the bear in any way. The anaesthetist has done his marvellous job. Let's see where we're going here. Let's see what we are. Right you are. A little more stuffing please, nurse. I'm just going to the chest cavity. Again, I think we can afford to be a little bit more generous, nurse, with the stuffing. After all, this is the NHS. Okay, now let's just have a look at that for a second. I'm just going to pull this back and see where we are. That's looking better, isn't it? Yeah, that's looking much better. A bit more down this side here, I think we should be done. Oh, that's slightly bit more. There we are. And I think that will probably be about right. Let me just check again. So, what do you think, nurse? Okay, so I'll leave the scissors here. If I can have the suture now, and yep, that's lovely. Okay. So the surgery is all complete now. We've got enough reconstruction work done. The head and neck canals are all in the right position. So we're just going to close the wound. Misha will then go to recovery, where the nurses will look after him for a little while until he's up and about. Make sure he's comfortable, pain-free and drinking. And then he'll be back on the ward, where no doubt he will indulge in his favourite bit of honey, as per the anaesthetist's wishes. So if you could just pass me that dressing there, Nurse Wishart. Faint heart, sorry. Suture back to you. Scissors back to you. And the small dressing on. Okay, so Misha's back in recovery now, and we'll be slowly waking up. So we'll keep the oxygen going on, just keep that running at about 5 litres a minute. We'll just open up the eyes again, take this off. There you are, Misha. Sit you up a little bit. That's good, and we don't need the fluids anymore, so these can come off. Just cut that off there, because Misha will be drinking fluids before he goes back to the ward. You're doing very well. The surgeon is very happy, as am I, and everything was a great success. So well done. And I'll be back in a few minutes to check on how you are. Okay, Misha, how are you feeling now? It's been a few minutes since you last saw me. I'm the anaesthetist, you may remember.
Мама чё сплачил?
Мишенька, он спрашивает, если ты его помнишь.
Не помню его.
Okay, so you're feeling okay? You're not too much pain?
Мишенька, как ты себя чувствуешь?
Я лучше, я проснулся.
Okay, so you're saying, well, I think what we'll do now is we'll take this mask off now. I think we've had enough of that. There you are. You seem to be breathing fine. Everything's going well. And I think the best thing for us to do is get you back up on the ward, back with your mum, and have a nice couple of spoons of honey. Yeah?
Honey, I know. Honey, мам, honey, это мед. Правда, honey. Я знаю honey.
Да, Мишенька. Да, доктор разрешил нам пойти в палату и немножко тебе поесть меда.
And we'll take this out when you're back on the ward and you've had your first glass of honey and some water. Lots of water, okay? So once you've had those and you're feeling well, we'll take this out and you can go home. Well done. Okay, hello Misha. How are you feeling? You're back on the ward for a little while now, so I thought I'd come and check on you to see if you had your honey and had your water.
He's a bit sleepy yet, so he can't talk to you at the moment. He's a bit sleepy, but he's feeling very well.
And he's had something to eat and drink?
Yes, he had, yeah.
Oh, lovely. Well, I think in that case we can pop this little candle out here.
Oh, yes, please.
Let's get that out of the way, okay? And then that way you're all free to go home once all your medications have been made. And away we go. There we go. Just pop that over there. That's lovely. And there you are. Okay. Bye bye, Misha.
Bye.
Ah, hello, Misha. How are you doing?
I am feeling okay.
You feeling well?
All of a sudden, I started speaking English for some reason.
Oh, well, that's very good. We've done something, haven't we? You can speak English and Russian. Well, that's very good. But then you are a clever bear.
Did you put something in my head instead of sawdust?
No, just regular bear stuffing. Now, what I want to do is have a quick look at the wound, if I may. Yeah? So I'll have a quick look under here, just for a second. Have a look. Oh yes, that all looks lovely and dry and clean. Now, as you can see already, your head is sitting much higher than it was. Yeah?
Ой, правда, она так прям у меня так моя голова прям такая прямая.
Exactly. Well, this is going to cure your curiosity, and you'll be able to look around and chatterbox again. But when your throat's not quite so sore, I'll give it another day, another 24 hours before you start chatting too much.
И потом завтра я могу разговаривать много.
He's asking if he can chat a lot tomorrow.
Oh, tomorrow you can chat as much as you like. I think the operation has been a huge success, and you have many chatting years ahead of you. So that's absolutely lovely. Anyway, I must go because I've got lots of patients to see, and I'm booked on the golf course at 5:30. Anyway, tatty bye, and I'll see you in...
Спасибо. I was по-английски now. Thank you.
Well, I should say спасибо, Misha, and I'll see you again soon. Bye-bye.
Ну вот Мишенька и дома. Он теперь выздоравливает. Как доктор и посоветовал нам, ему очень много надо есть меда и всего вкусного и сладкого. Кушай на здоровье, мой маленький, поправляйся. Что у нас тут? У нас тут немецкий штолен, у нас тут мед у нас тут арахисовое масло, шоколадное масло, жидкий мед. Кушай, мой сладенький, кушай, мой хорошенький.